name's Rodney Phillips, and I work with the Huron Perth Healthcare Alliance. I have the pleasure of managing the outpatient mental health programs with the Alliance. Yeah, I'll always take the opportunity to be an advocate for mental health. I believe that mental health should be a priority for everyone and anyone, as mental health and wellness go hand in hand. You want to make sure that you take the time to take stock in your own mental health and well-being, and in prioritizing that, and not only gives you the capacity to manage and work through day-to-day stresses of life, but then you also have the capacity to support loved ones in your life when they have concerns. So that for that reason, I'll always be an advocate and prioritizing and taking care of your own mental health. But on top of that, I get to be in a position where I can advocate for improved programs and more funding that goes into programs that supports our community's overall well-being. My work is pretty unique, or cool, I guess, in that I get to support the individuals that work the front line. So some of the programs I support, for example, is our 24-hour crisis team. So that team is there at any time for someone who's experiencing a crisis or somebody that needs support with a loved one who's in crisis. So my job is to be there to support the ones that are answering the phones, that are right there on the front lines working, but also to advocate for more resources, more programs, more support for my teams who are right there doing the great work with our community. Yeah, so for me, I like to really stress around prioritizing a healthy routine, whatever that looks like for an individual. I know it can be so different, but having a routine that includes a good sleep schedule, nutrition, exercise, but also including wellness in there. You know, wellness looks different for everybody, but prioritizing and doing those things that make you happy, that recharge your batteries, so to speak, and taking stock in what your resources are. We often talk about, sometimes we focus too much on our stressors and deficits, but taking the time to appreciate family, friends, maybe a therapist, a recreation group that you enjoy. What are your strengths that keep you charged? Would be my advice. I like to think that, you know, happiness isn't necessarily a state of being, but it's a mood, it's a feeling, and we need to prioritize those things in our life that provide us with happiness. Important message I want to share is that, you know, mental health affects everybody in a variety of different ways. Once again, prioritize your mental health. Quite often when our lives get stressful, things we do to prioritize our own mental health are the first that go out the window. So making sure that we are taking care of ourselves. And also, if you find that things aren't going well, so you find that maybe you're using alcohol or drugs more, you're more irritable, or you're even having thoughts of harming yourself or someone else, reach out. We have amazing people in our community who are here to help. And when you reach out, you find supports that are not judgmental, and you find caring people there ready to help you. Yeah, definitely. So like I was mentioning before, one of the programs that I support is the Helpline and Crisis Response Team. So that team is available 24 hours a day that you can call. The number there is 1-888-829-7484. When you call that number, you're going to get a supportive individual who's trained in crisis supports, who's able to provide you with a safe space to talk about what you're worried about. They also are there to support you if you're worried about a friend, family, or loved one. So I'd like to talk about that program, in that, you know, with making that call, they can help you decide what are some next steps based on kind of what you want and what feels comfortable for you.